Start by washing your hands, greet the patient and obtain consent for the examination. Ensure that a chaperone is present and that you have adequate exposure. Inspect gait, asking the patient to walk away, turn around and walk back, commenting on any abnormalities. Now examine the spine, commenting on any abnormal kyphosis, lordosis, or scoliosis. Now ensure a thorough inspection from the front, back and sides of the patient, looking for any fasciculations, wasting or scars. Perform Romberg's test. Ask the patient to stand with their feet together, arms by their sides and eyes closed. Loss of proprioception will result in loss of stability. You may now perform a quick cerebellar screen, as this may be useful to fine-tune the differential diagnosis early on in the examination. Ensure the patient is not in any pain and proceed to assess tone, power, coordination, sensation and reflexes, remembering to examine each side. Examine the patient on a couch, lying at 45 degrees for upper limbs or flat for lower limbs. Beginning with tone of the upper limbs, assess the tone starting at the shoulder, ulnar-humeral joint, radio-ulnar joint and wrist, examining the other side as well. Moving on to assess power, examine C5 by testing shoulder abduction, C5 and C6 to test elbow flexion, C7, C8 elbow extension, C7 metacarpophalangeal joint extension, T1 finger abduction, C8 thumb interphalangeal joint flexion, and T1 thumb abduction. Now test coordination using the finger nose test. Examining both sides. And testing dysdiadochokinesis. Moving on to sensation, you should assess at least one modality from each spinal pathway. Assessing the anterolateral spinothalamic tract, you may assess pain. Using a neurological pin, instruct the patient to close their eyes and test the normal area first. Ask the patient to compare this intensity to the remaining areas being tested, asking them to say yes each time they feel the pin with the same intensity. If they do not respond, ascertain if this intensity is more or less than normal. Test the dermatomes C3, C4, C5, C6, C7, C8, T1, T2. The other modality that may be tested here is temperature. To test the dorsal columns, you may assess light touch, using cotton wool to assess each dermatome gently. Do this in a similar manner to pain and do not sweep the strand across the skin. Test the dermatomes C3, C4, C5, C6, C7, C8, T1, T2. Other modalities that may be tested here include proprioception, two-point discrimination and vibration. Now move on to reflexes. Test biceps, C5, C6, comparing each side. Supinator, C5, C6. And triceps, C7, C8. Now lie the patient flat and move on to examine the lower limbs. Begin by assessing tone. Facing the patient's feet, place one hand just proximal to each knee joint and quickly roll the knees externally and internally, looking for symmetrical movements of the toes. Place both hands under the patient's leg, just proximal to the knee, and quickly flick each knee off the table. The patient's heel should remain on the examination couch unless there is hypertonia, in which case the heel will also lift off the couch. Examine for clonus, supporting the patient's flexed knee with one hand. Quickly dorsiflex the foot and hold this position. Clonus is present if the foot continues to move in a rhythmical manner and is indicative of an upper motor neuron lesion. Now assess power, testing the following myotones: L2, L3 hip adduction, L2, L3 hip flexion, L4, L5 hip extension, L3, L4 knee extension, L5, S1 knee flexion, L4, L5 ankle dorsiflexion, S1, S2 ankle plantar flexion, L5, S1 ankle eversion, and L5 hallux extension. Now check both sides for coordination using the heel-shin test. Now examine sensation, and you should test at least one modality from each spinal pathway. To test the anterolateral spinothalamic tracts, you may assess pain. Use a neurological pin and instruct the patient to close their eyes. Test the normal area first, instructing the patient to compare this intensity to the remaining areas being tested. Ask the patient to say yes each time they feel the pin with the same intensity. If they do not respond, ascertain if this intensity is more or less than normal. Test the following dermatomes: L1, L2, L3, L4, L5, S1, S2, you should also test S3, 4 and 5, noting these are gluteal and perianal. The other modality that may be tested here is temperature. Now to assess the dorsal columns, test light touch. Use a strand of cotton wool to touch each dermatome gently in turn. Do this in a similar manner to pain and do not sweep the strand across the skin. Again, test the dermatomes L1, L2, L3, L4, L5, S1, S2. Again, you should test S3, 4 and 5, noting these are gluteal and perianal. Other modalities that may be tested here include proprioception, two-point discrimination, and vibration. Move on to test reflexes, starting with the knee jerk, testing L3, L4. Test the ankle jerk, testing S1, S2. And the Babinski reflex, testing L4 to S2. Finish your examination by eliciting the abdominal and anal reflexes and the bulbocavernosus and cremasteric reflexes as appropriate. Thank the patient and help them to get dressed.